Good afternoon, everyone. Thank you for joining us for our first COVID-19 update for the year. My name is Jocelyn Castillo, Community Health Specialist at the Yakima Health District. Joining us today is our Interim Health Officer, Dr. Larry Yecha. Thank you, Dr. Yecha, for being here with us today.
It's good to be here. Thank you.
Thank you. Dr. Yecha will be giving a brief update on COVID-19 in our community, and as well as answering some COVID-19 questions from the community. We'll hear from him in just a moment. To start, just like our previous updates, I'll share some information on our current numbers. As of yesterday, we've reached a total of 21,902 cases of COVID-19. There are 59 individuals who are currently hospitalized due to COVID-19. 5 of those are currently intubated. And unfortunately, over the last week, we have lost more members of our community due to COVID-19, increasing the total number of deaths to 311. Some good news, as we mentioned during our last update, is that the COVID-19 vaccine is currently being distributed to hospitals and healthcare facilities in our county. At this point in time, we are still focused on phase 1A of COVID-19 vaccine distribution. This category includes healthcare workers and first responders who are at an increased risk of exposure to COVID-19 because they work with people who have COVID-19 or are suspected to have COVID-19. Other groups in this category include residents and staff from long-term care facilities. The hospitals and healthcare facilities that have received the vaccine are continuing to work through their staff to get them vaccinated. The Yakima Health District is also continuing to work with these organizations to administer vaccines to other healthcare providers and first responders who may not be affiliated with those organizations. Long-term care facilities, residents and staff from those facilities will be served through a federal pharmacy partnership with CVS, Walgreens, and other select pharmacies. Those pharmacies will be offering vaccines on site to those facilities. We also want to note that we know we've heard from the community that a lot of you are curious on when you will be getting the COVID-19 vaccine. This is a time-consuming process, the distribution process, and we are limited in how many vaccines we are receiving by the state. Unfortunately, the facilities that are receiving that vaccine are also limited on how many they can administer to their staff. And this is also due to the limited amount of vaccines they're receiving, and also how they're prioritizing their staff. We know that many members of the community are eager to know when a vaccine will be available to them, and we are so glad that so many people in our community want to get vaccinated. But due to the limited supply of the vaccine, we do have to follow this phased approach for distribution. Our county is also the 5th most populous county in Washington, and we do have a larger number of healthcare workers than other parts of the state. So it will take some time for us to get through phase 1A of distribution as well. We will be releasing more information on the COVID-19 vaccine distribution here in our county tomorrow. So please stay tuned for that. All of our media releases are available on our website as well as on our social media. And then with that, I also just want to remind everyone that while we wait for a vaccine to become widely available, let's not forget that there's other tools that we can use to reduce the spread of the virus. That includes wearing a mask in public places, along with staying 6 feet apart from others, avoid or limit social gatherings, and practice good hygiene habits at home, work, and other public places. All of these methods have helped us before and can help us now. Other good news is that the free community-based testing at the Yakima State Fair Park and Sunnyside Community Center will continue. Both of these sites will continue to operate during normal hours. The Yakima State Fair Park testing site operates from Tuesday to Saturday, 9 a.m. to 3 p.m. However, Thursdays they do open from 12 p.m. to 6 p.m. The Sunnyside site opens Sunday to Thursday, 9 a.m. to 3 p.m. And on Tuesdays is when they open from 12 p.m. to 6 p.m. Testing is free and open to all Yakima County residents. So please, if you have symptoms of COVID-19 or have been exposed to someone with COVID-19, please make sure you get tested. Stay home until you wait for your results. And if you are positive, try to separate yourself from others in your household until you complete your isolation period. So with that, I'll turn it over now to Dr. Jecha, who will give us just a quick update on COVID-19 here in the county. Go ahead, Dr. Jecha.
Well, thank you. And I want to thank all the health department staff. They've done just a fantastic job of greeting me and making me welcome into the group. So appreciate that. As you know, we've really been on a high point, and it's kind of a plateaued at a high rate of 150 to 200 a day. And that seems to be keeping the same. Our worries were the surge for the holidays. And we should be seeing that starting now. We haven't yet. We're keeping our fingers crossed that we can get at least stay stable for a couple of days and then start going down. So that's our hope. And we appreciate everyone that's trying to do their best to prevent COVID in our community by masking up, safe distancing, and all those things. We still have social gatherings still seem to be our Achilles heel. And then it's spread to after someone gets positive from a social gathering, it gets throughout the family. So everyone take caution in that. Appreciate it.
Thank you, Dr. Jecha, for that update. So now we'll move on to some questions. With the arrival of the COVID-19 vaccine, we've gotten many questions about the actual vaccines. So one of the questions that we get most commonly is whether the vaccine is safe, even though it was developed pretty quickly.
Yes, I think it's very safe. It's gone through a lot of testing, stringent testing, and it's a new vaccine, but the concept isn't new. It's an RNA particles that teach the cells to make a protein, and then the body makes antibodies to attack the virus, the spiky protein, we call it, on the surface of the virus. So it's a little different action than what we see in our weakened or inactivated vaccines in the past. Like I say, it's the concept is used in cancer treatment to fool those antibodies to fight cancer. So the concept's not new, but using this concept in a vaccine, and it seems to be very effective, which is very kind of surprising to me, but I'm really glad, and I think it's going to be a great help to preventing COVID in our community.
Thank you, Dr. Jecha, for that answer. Another question is, how long does it take for the vaccine to work once it's been administered?
Okay, good question. This is a 2-dose vaccine, as you know, and it takes that really second dose to make sure that you are protected. It's given, depends on the vaccine, 21 to 30 days after the first vaccination. You will get some antibody buildup, but we don't know what that is from the first to the second. Someone says it's 50%. Really not known, but we know that after the second shot, within 2 weeks, you will have good protection, 95% efficacy, which is great.
Thank you. The last COVID-19 vaccine question we have is whether it's possible for someone to get COVID-19 even after getting vaccinated.
Yes, it is. It's not recommended till all your symptoms and your isolation quarantine measures have been taken place. And but it's still, you can give it in. I would recommend 30 days to probably get it after you've had the actual COVID to get a vaccine. But it is safe, although you're protected at least up to 90 days because of the vaccine. So if other people are more important to get vaccinated in front of the line, it doesn't hurt to wait until after that 90-day period to get your first vaccine if you've had it in the past.
Thank you, Dr. Jecha. There's also been a couple of questions around COVID-19 testing. We know there are many different tests out there. Could you provide just some more information on what the different types of tests are and how they work?
Really mainly 3 different types. You see the PCR test, which is mostly done. It's against the genetic material inside the virus. So it is positive for a lot longer than the antigen. The antigen is the proteins around the surface of the virus, the antigen test. And the PCR is more accurate in some ways because there's a bigger window when it is positive. The antigen is positive, but it's only about a 2-week window, and it's when you're really infective. So it's an effective test given in symptomatic people. And so the antigen has an effect of being very good for people that are symptomatic. And then there's the antibody testing, and some are promoting that. Well, all antibody testing is have you had something in the past? And it doesn't, it won't tell you if you have a current disease or anything. It is helpful to know that if you've been exposed to it in the past. So it's really not needed in what we're doing for trying to find symptomatic patients. So it's more of a research to see how many people have been infected in the past and things like that. So that's really your 3 different tests. The PCR does take 24 to 48 hours, maybe even longer, and the antigen is within 15 minutes. So there's a time and place for both, and they both can be effective. Just use them in the right way.
Thank you. That's good information, Doctor. And then we also have just some questions on when it's okay to return to work after someone's tested positive for COVID-19.
Okay. After you've been tested, you need to wait until 24 hours after fever. Symptoms should be going down, and 10 days since you became symptomatic. After the 10 days, you shouldn't be infected anymore.
Okay. So is a negative test result needed?
As I was explaining, I'm sorry. the PCR test is usually the one that's done, and PCR can be positive for up to 90 days after your disease. So if you wait that long, we wouldn't have anybody going back to work. But no, you don't want to test again once you've had the disease and it's been more than 10 days.
Okay. Thank you, Dr. Jecha. Any other comments?
No, it's, you know, this is a long struggle. I've never been in a pandemic before. We've read about the pandemic of 19, you know, in the past with the flu pandemics, and we were preparing for H1N1, but this is really nothing like I did for the preparation of H1N1. It's mind-boggling, and I appreciate all the medical personnel out there. I mean, they're really stressed. They've been stressed since March, and I want to just thank them for all they're doing, taking care of these patients. It's hard work.
Thank you, Dr. Jecha. Well, that's all we have for today's update. As always, please leave questions or comments that you would like us to address for our next update in the comment section below. Thank you all for watching. See you next time.